Hi guys, hi, this is Ava from Bay Harbor Med Spa, and I'm going to share with you a question about laser hair removal, and perhaps that will be beneficial for you out there to listen to. One of the many questions that I get from people who come to my clinic for consultation for laser hair removal is women that have hairs on their neck, they have hairs on the chin, have hairs here, which is of course a hormonal imbalance, which happens most likely due to uh, elevated testosterone, elevated other hormones, disturbance in your thyroid, or PCOS, or ovarian cysts, reproductive organs of females, or sometimes it's heredity. However, 99% a problem of excessive hair growth is related to hormones. Sometimes it can be hormones and diabetes. Now, to answer your question, guys, and what I tell people who come to my clinic for consultation is that the only way that you can get rid of hormonally induced hair growth on the face, particularly women, is only with a true laser. True lasers are the only modality that will get rid of the hair permanently. However, please remember, permanent does not mean one-time treatment. Permanent means that it is a treatment that will take some time. It might take 2 years before you will be done. So lasers are the only treatments that will remove permanently the hairs that are induced due to hormones or heavy hair growth, to many other reasons. What I tell people who come to my clinic is, when that is the problem on the chin and it is hormonally induced, I say, okay, you go get your blood work, either go to an endocrinologist or go to a gynecologist. Have all the comprehensive blood work done to find out which hormones are elevated, what's off. And then the doctor that treats you should be the one to try to work out and lever your hormones. However, no matter what you do in the meantime, the only way you can get rid of those follicles that are active, that make you excessive hair growth, is laser. That's the only method, is laser hair removal. And so there's no need to wait when this problem occurs. And that's what I tell to all the people that come to me for laser hair removal is, no, you don't have to wait. You go simultaneously. The reason you go simultaneously is because you want to find out as a patient, the person who has the problem of excessive hair growth, you want to find out why you have this problem. And when you find out why you have this problem, which usually you find out from your family history, from your medical intake, and from blood work, then you will get treated with the appropriate hormones, balances, bioidentical hormones, whatever it be, thyroid medication, so that you balance your hormones and that you stop producing more hair, so that you stop stimulating additional hair growth. However, all those follicles, all those hairs that you have, there is nothing in the world, no medication, nothing in the world that you will take from this point on that will get rid of it. So those follicles that already gave you hairs, those are active. Those follicles have to be destroyed. They have to be killed. Finished, 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 finished. The only way you can finish those and destroy these follicles is with laser hair removal. So yes, it is hand in hand. You go, you do, you find out what the reason is for your hair growth, start taking the appropriate medication after you do your test, and simultaneously you do laser hair removal. And yes, there is hope. You will get rid of the hairs permanently, but it might take you 2 years. It might take some time until this will be done, because you have a hormonal imbalance and you have all these stimuli in your bloodstream that stimulate your growth of your hairs. It stimulates the follicles, because we do understand that the reason that hormones stimulate your hair, and how it basically works is this: Every human hair under the skin, which is deep down under the skin, is connected. Every hair is connected to a little blood vessel. And it's that blood vessel that carries blood and carries hormones. It's that blood that feeds the hair. Otherwise, the hair would die. So it's these blood vessels that feed the hair. And so when you destroy the follicle, you actually are destroying, you are separating, you are cauterizing. The blood vessel is separated from the follicle. And once the blood vessel no longer is able to supply blood, food, nourishment to the hair follicle, the follicle will die. So that's the answer. This is how it works, and it's a process. But maybe now you understand why you need to go and find out what the problem is, why you have excessive hair growth, what's the imbalance in hormones, and why you simultaneously have to do the treatments, because those follicles that are already active and are stimulated, those can be only destroyed with laser. So I hope I answered this to the best of my ability, and it will help a lot of you out there. Okay? So thanks. Bye. Until next time.